Here's something that happened in January 2026. A research paper landed in the headlines. The phrase was everywhere. Exercise is as good as antidepressants. And the response? Half the people shared it with a thumbs up. The other half got angry. Clinicians were saying it was oversimplified. Patients on medication felt dismissed. And the wellness world ran with it like a victory lap. But here's what I noticed as a physiotherapist. Nobody was actually reading the study. They were reading the headline. And headlines and science are very different things. So today I want to do something simple. I want to read it with you. And then I want to show you something the headlines completely missed. Something that honestly changes everything. Welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. And this is the show where we take the best of what Western science is discovering and bring it into conversation with the wisdom traditions that have known these things for thousands of years. Today's episode, Movement, the Brain, and Mental Health. Let's go. Let's start with what actually happened. In early 2024, a landmark paper was published in the BMJ, the British Medical Journal, one of the most respected clinical journals on the planet. It was a network meta-analysis, which means researchers pulled and compared hundreds of randomized controlled trials involving nearly 15,000 people. The conclusion? Exercise is a valid, evidence-based treatment for depression, comparable in effectiveness to antidepressants and psychotherapy for mild to moderate presentations. That's a genuine finding. That matters. But here's where the headline started to drift. Some versions of the story said exercise is better than antidepressants. Others said it's more effective than therapy. And one widely shared version claimed it was 1.5 times more powerful than medication. That specific claim? It came from comparing apples to oranges, pulling effect sizes from studies of different quality levels. The researchers behind the actual BMJ study pushed back on that. The honest finding is this. For non-severe depression, exercise and antidepressants show no statistically significant difference in outcome. They are comparable. That is still a remarkable result, but it is not exercise is better. It is exercise belongs at the table. And I think that matters because when we overstate findings, we lose the people who most need to hear them. Someone who's been on medication for years reads exercise is better than pills and feels implicitly judged. A GP reads the same headline and dismisses the whole conversation. The nuance is not just academic, it protects the message. So let's go deeper. Why does exercise actually help the depressed brain? Because when you understand the mechanism, it stops being a lifestyle tip and starts being medicine. The answer starts with a protein called BDNF, brain-derived neurotrophic factor. Think of it as fertilizer for your neurons. It supports the growth, survival, and connectivity of brain cells, particularly in the hippocampus, which is one of the regions most consistently affected by depression. In people who are depressed, hippocampal volume is often reduced. BDNF levels are low. Here's what's remarkable. Both antidepressants and aerobic exercise increase BDNF. They share the same neurochemical target. But exercise does something medication doesn't. It also reduces inflammation. Studies show that regular physical activity lowers pro-inflammatory cytokines like interleukin-1 beta and TNF-alpha while increasing anti-inflammatory factors. It stabilizes the stress hormone cortisol. It activates the endocannabinoid system, the same system involved in that sense of calm and ease. And the running-versus-SSRI trial from 2023 made this visible in a very direct way. Patients with depression and anxiety were randomized to either 16 weeks of structured running therapy 3 times per week or a standard course of SSRI antidepressant medication. The outcomes for depression were equivalent, but the physical health outcomes were not equivalent at all. The exercise group improved cardiovascular fitness, reduced BMI, and decreased inflammation markers. The antidepressant group saw increased body weight and no improvement in inflammatory load. That's not an argument against medication. Antidepressants save lives. For many people, they are essential. But it is an argument that exercise has a biological reach, that medication doesn't, and that reach matters, especially when we're thinking about whole person health. There's one more piece of the science I want to share because it surprised me when I first read it. This is called the autonomy paradox. Multiple studies found that when researchers gave depressed patients complete freedom to choose their own exercise, the type, the frequency, the intensity, the mental health effects were weaker. But when patients received a formal structured prescription, like a doctor prescribing a specific dose of medication, the effects were significantly stronger. What that tells us is that one of the symptoms of depression, that reduced sense of self-efficacy, that difficulty initiating and committing, is actually a barrier to using exercise as medicine, unless there's structure and accountability. General advice to go for a walk is not the same as a real exercise prescription. The dose, the type, the frequency, that specificity is what activates the therapeutic effect. Now here's where I want to bring in something that the headlines never touched, because Western research is just catching up to something that Eastern health traditions have understood for a very long time. A 2024 network meta-analysis published in Frontiers in Psychiatry pulled 42 studies involving nearly 3,000 participants and ranked different types of mind-body exercise for their effect on both depression and anxiety in older adults. The ranking for depression, Tai Chi came first, then Pilates, then yoga, then Qigong. Tai Chi ranked number 1, a practice that is literally thousands of years old. Now you might think, well, that's just because it's gentle and accessible. But the researchers went further. They found that Tai Chi specifically reduces sympathetic nervous system activity. It modulates functional connectivity in the brain's cognitive control network, and the particular mediators it produces, including TGF-beta and interleukin-10, are associated with psychological stress reduction in ways that aerobic exercise simply cannot replicate. And here's the nuance that makes this even more interesting. It's not all Tai Chi equally. The most effective version for older adults with depression wasn't the traditional Yang style or Sun style. It was a specially adapted Tai Chi exercise program, designed to be responsive to individual needs and limitations. Whereas Sun style Tai Chi, which uses compact, highly coordinated small frame postures, was actually less effective for people with restricted mobility. This is the bridge. Western science spending billions of dollars to understand why exercise heals the depressed brain, and arriving through neuroscience at a practice that Taoist philosophy has offered for millennia, the breath that synchronizes body and mind, the slow movement that trains attention back to the present, the nervous system that learns through gentle repetition to find stillness. We didn't need the network meta-analysis to know Tai Chi was medicine, but I am deeply grateful it now exists because it means we can offer this to patients within a clinical framework. It means GPs can recommend it. It means insurance bodies can consider it. It means the divide between ancient wisdom and modern healthcare gets one notch smaller. So, what do you actually do with all of this? Here are 5 evidence backed takeaways. 1. Treat exercise as a legitimate treatment option, not a lifestyle bonus. For mild to moderate depression, the evidence is now comparable to medication. NICE guidelines, the European Psychiatric Association, and Australian REN-CP guidelines all endorse it. If you're experiencing low mood, bringing movement into a clinical conversation is entirely valid. 2. Ask for a prescription, not a pamphlet. When you see a GP, physiotherapist, or exercise physiologist about mental health, ask for a structured exercise prescription, frequency, intensity, duration, and type, not general advice. The research is clear that structure outperforms choice when depression is affecting motivation and self-efficacy. 3. Aim for 12 weeks minimum. Don't expect a 2-week burst to move the needle. The biological changes, neurogenesis, reduced inflammation, normalized cortisol, accumulate over time. The research points to 12 weeks as the optimal onset window for significant antidepressant effects. That's your minimum investment. 4. Match your movement to your profile. If you're younger and find resistance training appealing, the evidence is strong. If you're an older adult, Tai Chi or Qigong may actually be the most powerful option, both biologically and from an adherence standpoint. Yoga delivered in a group setting shows particularly strong outcomes for sustained engagement. There is no single best exercise. There is best exercise for you. 5. If you're on medication, exercise is your ally, not your exit strategy. The combination of exercise and antidepressants can increase BDNF levels in as little as 2 days compared with 2 weeks from medication alone. The goal isn't to replace treatment. The goal is to make treatment work better while adding benefits your medication cannot provide. I want to come back to that headline one more time before we close, because I think there's something important buried in the reaction it caused. The reason that headline spread so fast, the reason it hit a nerve, is that a lot of people already knew this, not from a randomized controlled trial. They knew it because they went for a run in the middle of a dark week and something shifted. They knew it because they started Tai Chi and found the stillness they hadn't felt in years. They knew it because movement somehow made them feel more like themselves. Science is catching up to what the body already knows. And what I love about this moment in medicine is that the catching up is happening loudly enough that it's changing guidelines, changing prescriptions, changing what GPs can offer. But wisdom traditions didn't wait for the catching up. Taoism, Buddhism, the great Eastern health systems, they understood that the body and mind are not separate, that movement is not exercise in the gym sense, that breath, presence, and gentle repetition are forms of healing that reach into places a pill cannot. We don't have to choose between these worlds. That's the whole point of the wellness bridge. We build the bridge and we walk it. If this episode was useful, share it with someone who's navigating depression or low mood. A friend, a family member, a patient. The evidence is there, the practice is available. The conversation needs to happen. I'm Gary Chen. Together we find balance in one. See you next time.